In this course, we are going to begin with revising the basic concepts about amphibiotherapy, what theory says. This is as I told before the presentation out loud. So we are going right now to focus on the basic concepts about amphibiotherapy, what theory says. The first point to be analyzed is what is an antimicrobial agent? Well, it's one of the main achievements of the human history, is the appearance of the antimicrobial agents. Why? Because the appearance of these agents avoid a lot of or try to control many bacterial diseases, not only in humans but also in veterinary species. The antimicrobial therapy aims the destruction of the infectious agents without damaging the host cell. This point is very critical. So the goal is to destroy agents, but without causing any damage to the host cells. The antimicrobial agents are traditionally divided in antibiotic, that produced by microorganisms, and chemotherapeutic, so those synthesized in the laboratory. But this classification right now is out of date. Why? Because many antimicrobials are synthesized in the laboratory from natural antibiotics. What theory says about antimicrobials? Well, the first point that we're going to revise is the spectrum of action of the antimicrobial agents. According to their mechanism of action, they are classified depending on the microorganism they can affect. So we can find white antimicrobial in the sense that they interfere in the growth of many bacterial species. We can find intermediate antimicrobial, so they can affect only a limited or a little amount of bacterial species, and reduce antimicrobial, so they are only effective on a very limited number of bacterial species. And when we are talking about antimicrobial classification, they can be classified according to several criteria. Okay? The more frequent are the spectrum of activity, so we have told before the bacteria they act on. The second one, this is the most used, is classified according to its mechanism of action, and the last one is about the chemical structure. This last one, the chemical structure, could be interesting for pharmacologists, but not for practitioners. If we take a look about the antimicrobial mechanism of action with a bacterial in front of us, we can classify the different antimicrobial in these different groups. We can find antimicrobial that they can act at level of the wall cell synthesis. So normally they inhibit the wall cell synthesis of the bacteria. Here we can find a very known familia of antimicrobial like penicillins and cephalosporins, for example. Afterwards, we can find also antimicrobials that they can affect the metabolism of the folic acid. There we can find the sulfonamides and the trimethoprim. This kind of antimicrobial has been used in the past a lot in veterinary species. Right now, we can find this familia is also used, but its use has been decreased a little bit. The third one is those antimicrobial that they can act at the level of the cellular membrane, like polymyxins. We're going to see later on that this antimicrobial produce like the extraction of the membrane by a detergent action. And here we can find the biggest group antimicrobial, those that can act at the level of the protein synthesis of the bacteria. And we can find two levels of actions. We can find the 50S fraction of the ribosome. There are the antimicrobial they act on this level are the macrolides, the thiamphenicol and 4-phenicols and lincosamides. And we can find also antimicrobials that they can act at the level of the 30S parts of the ribosome. There we can find a huge family used in veterinary species, in particular in pigs, the tetracyclines, and also the aminoglycoside. And the last family of antimicrobials that we can find here in the upper side of the slide, we can find the antimicrobials that they are able to act at the genome of the bacteria. In particular, we can find fluoroquinolones that they are able to block the DNA girase of of the bacteria, or even other familia there, the DNA-dependent RNA polymerase, like rifampicin, that they are able to block this enzyme, but this last group of antimicrobial are not in use for veterinary species. Are all the antimicrobials the same? The answer is no. Depending on the ability to produce the death of the microorganism, or only to stop its growth, they are bactericides or bacteriostatics, respectively. This is a very classical classification about antimicrobial, and everyone that is aware of these drugs know this classification. But what means really bacteriostatics? Here we can find this figure in the x-axis. It is a very simple representation about the bacterial load and the time. Okay, and A means different doses of the antimicrobial. Here we can observe that the antimicrobial is able only to block the multiplication of the bacteria, and the degrees that we can observe in this figure depends on the effect of the immune system of the host. So a fair message could be, if we are interested in using bacteriostatics antimicrobial, probably we need to have a very effective immune system. On the other hand, we can have antimicrobial with a bactericide effect of action. Here we can observe that the decrease of the bacterial loads is produced directly by the effect of the antimicrobial. Here A is every dose that we administer, but here is not represented, obviously, but we have also the effect of the immune system, but the decrease is mostly due to the effect of the antimicrobial. According to this activity about bactericides, we can find the following antimicrobial families, like beta-lactamics, penicillins, cephalosporins. These antimicrobials are widely used in swine production, polymyxins, quinolones, and aminoglycosides. Here in this slide you can observe different drugs that belong to the different families. And on the other hand, we can have also bacteriostatics antimicrobial. Here we have a lot of antimicrobials used also in pig production: macrolides, lincosamides, tetracyclines, phenicols, pleromutulins, and sulfonamides. And as the slide that we have talked before, here you can observe several drugs that belong to the different families. What about the criteria to establish antimicrobial therapy? Well, we must be taking into account 5 points. The first one must be the diagnosis. This is the critical point. We have to be sure about the pathogen involved in the disease. We must know the antibiogram of the bacteria and the antibacterial spectrum of the different antimicrobials. The second point, we must know the antimicrobial pharmacokinetics. So the absorption, the distribution, the metabolism, and the excretion of the different antimicrobials that we can theoretically choose. The third point is the side effects that the antimicrobial can produce. Fortunately, many antimicrobial it's very difficult to observe side effects due to antimicrobial, but it could be possible and it could be taken into account. Okay. The fourth point is the withdrawal period. This is a critical point for livestock, so we must know very well the withdrawal period of any antimicrobial. And the last point is the treatment course. This point is very critical for livestock because it could be a critical point to choose one antimicrobial instead of other. Do you really know how the treatment with antimicrobial works? Well, theoretically, to know quite well how the treatment works, here we can find a figure where 3 parts. The patient, it could be the pig, the drug, and the microorganism. And here we can observe the different relationship between them. The drug, it is related with the patient between pharmacokinetics. So it's about how the drug is absorbed, distributed, metabolism, and excreted. The drug is related with the microorganism with the pharmacodynamics. This is a system to measure the susceptibility. And the patient with the microorganism with the immune system. Okay? So the patient tried to control the microorganism with the immune system. So the global effect, that we're going to have with administer an antimicrobial is due not only to the antimicrobial but also to the effect on the immune system. Here we can observe also a relationship between the drug and the immune system. So the effect that the antimicrobial can have with the immune system of the host. But this point is not very well known, and we are going to overlook this point throughout this course. Well, what about the pharmacokinetic parameters associated with any antimicrobial agent? Well, before describing the different pharmacokinetic parameters, we're going to revise what happens when we administer antimicrobial in the host. At first, here in the upper side of the slides, we can observe the pharmaceutics. So how, after the application, the drug is dissociated from the solution that we administer. This part, we are not going to focus very much of that because this is part of the pharmaceutic. This is a very specific part for a pharmacologist and not interested at all for our practitioners. The second point is going to be very critical for us is the pharmacokinetics. So how the drug is absorbed, afterwards it is distributed throughout the body, and also is metabolized and excreted. All these processes take place at the same time. Okay? Afterwards, in connection with the distribution of the drug, this drug arrives to the place of effect. In this case, the place of effect is the bacteria. So there is where the pharmacological effect takes place. Okay? When we revise the different parts in connections with the pharmacokinetics, okay, here in this figure we can observe all of them summarized. A third one, in the left side of the slide, we can observe the different administration ways for any drug. Okay, in the case of pigs, we're going to focus with the oral and intramuscular administration, obviously, because the rest of the way of administrations are not in use for pigs. Afterwards, this drug is absorbed, okay, and go to, for example, to the gut, and for the gut is the place of absorption in the case of the oral administration, on the muscle for the intramuscular administration. Afterwards, go to the plasma. In this plasma, the drug is distributed throughout the body, okay, and then go to the liver. The liver is a very critical point because most of the metabolism take place there, okay, and also go to the kidney, and then from the kidney to the urine, and then the antimicrobial is excreted either by the urine if it came from the kidney directly, or for the feces if it came from the gut. Okay, here we can observe a very interesting point also, that from the plasma we can go through also to the breast and to the sweat glands, and even to be excreted through the milk. So the milk is not critical for porcine because the milk is not used for human use, okay? But in the case of cows, this point, for example, is very, very important. What about the main pharmacokinetic and pharmacodynamics parameters to be taken into account? For pharmacokinetics, we had 4. Area under the Q, this is AUC, Tmax, Cmax, and clearance. And from pharmacodynamics, we have 2. NIC, this is the minimum inhibitory concentration, and MBC, this is the minimum bactericidal concentration. What about the Cmax? Well, Cmax is a very easy concept. It's the maximum concentration of the drug reached after the administration of a single dose. Here we can observe like a Q that can be observed after any intramuscular administration, for example, and the Cmax is the maximum concentration. Tmax is the time in which the maximum concentration is reached. Okay? What about the area under the Q, or AUC? Is the area delimited by the plasmatic concentration versus time. It is normally calculated taking into account the posology interval, for example, 24 hours, for example. Area under the Q is a parameter that will allow us to know like the exposure, okay, of the antimicrobial to the host. So the higher is the AUC, the higher is the exposure for the for the host. Okay. What about the clearance? The clearance is the volume of the antimicrobial excreted per time unit and kilogram of leaf weight. Okay. This is a constant value for each drug and animal species. If it is kinetic, is linear. Fortunately, for antimicrobial, all the pharmacokinetics are linear, so the clearance is constant for any antimicrobial and any species. What about the volume of distribution? This is a constant of proportionality between the plasmatic concentration and the amount of antimicrobial in the organism. Here we can have like a question, no? Do you really think or believe that a high volume of distribution implies that the drug is widespread in the organism? The answer could be yes, but could be also no, because we can have also antimicrobial with a very specific tropism for tissue. So we can observe a high volume of distribution with a really low distribution to the rest of the tissues of the body. But normally the higher the volume of distribution, the higher is the distribution throughout the body. What about the half time? Half time is the time needed for the plasmatic concentration to decrease to 50% after the steady state is reached. This parameter is not very critical, but for example, for the posology regimen, but it's very interesting in the sense that we need at least between 3 and 5 half times in order to reach the steady state, okay, after multi-dose in any organism. What about the pharmacodynamic parameters to be taken into account? We have mainly two from the practical point of view. We have the NIC. This is the minimum inhibitory concentration. This is the lowest concentration of antimicrobial that inhibits completely the bacterial growth after 24 hours. It is determined in vitro by the very standard methods. Here you can find the CLSI. So everyone that could be interested in that how it is determined, you can look through internet and you will easily find this document by free. The MBC is the minimum bactericidal concentration. This is the lowest concentration that is able to reduce 3 logarithmic units the initial population. Okay, this is determined also in vitro by a means of the dilution methods published by the same organism that we have talked before. It could be very interesting, as we're going to focus later on, about to know the NIC 50 and the NBC, for example, 90. Why? Because it includes the 50 or 19% of the isolated studied at population level. Here we can observe the minimum inhibiting concentration of 16 antimicrobial against 68 anti-Actinobacillus pneumoniae isolates. Here, in the left side of the slide, we can observe a list of antimicrobials. Here we can see the range. That means the minimum and the maximum value observed from the NIC, and the NIC 50 and the NIC 90. So it's like intuitive, no, to assume that the lower is the NIC 90, the better could be the treatment with this antimicrobial. But take a look carefully to this table because, for example, for the first one, that is ampicillin, the range is quite high, but the NIC 90 is 0.39. If we analyze florfenicol, here we can observe that the NIC 90 is the same, but the range is very short. So it's better in the sense of the selection of antimicrobials. So the same NIC 90 with a very close range is better for any antimicrobial.